We're now a level 2 pediatric trauma center here at McLane Children's. That's important for the children and families of Central Texas because we're able to provide that advanced level of care for injured children here in our area. There's 4 different levels of trauma centers that are recognized in the state of Texas. Level 1 all the way down to level 4. For many years, Scott & White has been a level 1 trauma facility that treated both children and adults. In 2006, those criteria changed by the American College of Surgeons, where in order to be a designated or verified pediatric trauma center, you had to go through a pediatric verification site visit. We actually had our first one back in May of this year, 2013, and were successful receiving no criteria deficiencies, and were awarded a level 2 trauma verification by the American College of Surgeons and designation by the Department of State Health Services of Texas. So in regards to trauma with patients, obviously you want to get them to a tertiary facility that has all the capabilities to take care of their injuries because a lot of times time is of essence. There's many different ways that can be accomplished. That could be accomplished via a ground unit, ambulance, or it could be accomplished by a helicopter, as you see behind us. One of the missions of McLane Children's when the hospital was built was that we developed an all-inclusive transport program. For many years, McLane Children's provided a neonatal transport program for neonates, but when the Children's Hospital was developed, they wanted to include the pediatric component of that as well. So over the last year, we've significantly grown the children's transport team to not only have its own dedicated children's ambulance, but now its own dedicated children's helicopter that could provide that rapid transport for injured children.